It's your first day of chemotherapy, and understandably, it's a very difficult day because you're unsure and uncertain of what to expect during chemotherapy and after chemotherapy. Now, chemotherapy is not easy, but it's also not as difficult as a lot of people imagine it to be.
People associate chemotherapy with hardship, with suffering, with danger. But I would say that the modern chemotherapy is quite different from that. While the risk continues to be there, chemotherapy can be safely managed. In fact, today, most of the chemotherapy is given as an outpatient without you visiting the hospital at all. And your doctor will carefully choose your treatment, whether it's chemotherapy or other modality.
Your doctor will also be the one who will be looking after you throughout your chemotherapy regimen and throughout the course of chemotherapy. So he or she will be seeing you regularly, often during chemotherapy before each cycle. If you're experiencing any unusual side effects or if you're not feeling well, your doctor will always be there to help you through this whole chemotherapy journey.
There's an entire team of people working with you. It's not just the doctor. A very important element of the team are the nurses. Now, these are the wonderful people who'll be with you for many hours in your cancer journey. They will see you much more often than you see the doctor. So they will get to know you well, you get to know them well. When you're having chemotherapy for the 1-2 hours or longer, they are with you all the time. So when you're on treatment, feel free. Let them know if you feel some discomfort.
So there's also the patient service officers who are a very important part of the team. They are the ones who will be helping you with the appointments, with the blood tests, even insurance as well. So whatever questions you might have about paperwork, about claims, they are the ones that you will be meeting and dealing with most of the time.
In ICON SOC, we're also having a team of pharmacists. And these are professional people who understand cancer drugs. They will help the doctors and nurses to make sure that the right drugs are delivered to the right patient at the right dose. In a way, when you come for treatment, regard us as a team of people surrounding you, walking with you, very much the same way as you fly on a plane. I'm the pilot, but I have many crew members with me to make sure the journey is safe.
So the important thing to note on your first day of chemotherapy is to be very helpful to have somebody come in with you to accompany you during the chemotherapy and also importantly to bring you home after chemotherapy. It's also useful to take a few days off work to rest.
For your first cycle of treatment, you may need to come in as often as weekly for the doctor to check on you, and we also might need you to do blood tests to make sure that your counts do not fall too low and that you are coping well with the treatment. So if there's any side effects that you have experienced in the past 1 week, do highlight it to the doctor who will address it.
Chemotherapy can sometimes be quite long, even up to a few hours. Rest assured that there are things that you can still do. Some patients you may be able to eat even during your chemotherapy.
We actually have Wi-Fi connection in the clinic, so in case you want to download a movie to watch or you want to listen to music, you could go ahead and do that.
Often our chemotherapy chairs are quite comfortable and many of them can be inclined all the way down to be like a bed so that you can even sleep. You can even go to the toilet. You're not confined to the chair during chemotherapy. Most of the time, most patients do not feel much, and they feel quite well during the actual chemotherapy itself. Chemotherapy can be given once a week, once every 2 weeks, once every 3 weeks, or even once every 4 weeks. So your doctor will explain to you how often you need your chemotherapy, and depending on the regimen that's most suitable for your type of cancer, that's how often you need to come in.
The treatment is given intravenously. The nurse will be putting in a cannula through your vein. It's a small needle prick, just a pain for a little while, and then during the infusion, you will not experience any further pain sensation.
And then your chemotherapy may last from anything from half an hour to even 6 hours, depending on the type of chemotherapy regimen that your doctor has advised you to go through. Once your chemotherapy is over, the nurses may monitor your blood pressure, your heart rate, and just make sure that you feel well before we allow you to go home. When you go home, we will also give you advice on certain medications that you may need to take. This may be tablets that we may need to give to you to prevent nausea over the next few days. And sometimes you might need to have an injection as well to boost your immune system so that it will reduce your risk of getting infections.
The symptoms that you experience during your treatment are going to be generally manageable. And many patients like you have gone through this. We are familiar with the treatment and the side effects, so we're with you. However, it's important to know not every patient gets these side effects, and most times the side effects are manageable with the way we do chemotherapy these days.
Cross the bridge when you come to it, so don't have to worry, "Oh, will I have this effect, will I have that effect?" Because you know why? All of us have different bodies, so we're all going to experience different side effects. So, I mean, like the doctors gave me a list of like maybe 10 side effects, but I actually just had maybe like 4 out of the 10, so don't worry too much about it.
Most patients are worried about hair loss with chemotherapy. First of all, not all chemotherapy treatment leads to hair loss. Some do, some don't. And for those that do cause hair loss, be reassured that as soon as your chemo finishes, the hair will start to regrow, and typically, in about 6 months' time, your hair is back to where it was before.
It made me feel like I had a disease in the head because like some part of it you had hair and some part was bald. So I decided to take things into my hand. I'm not going to wait until all the hair dropped. So what I did was I bought a wig and immediately I went to my hairdresser and I told them to shave me bald. Sad to say, okay, there was not a dry eye in the salon because when they know that I had breast cancer and they shaved me bald, I mean, it was a sad state. But then after the baldness and then I put on my wig before I went out of the salon, I tell you, I look sensational.
The most common side effect of all would be fatigue. Sometimes it could be just for a day or two after chemotherapy, or it could be even for up to a week or longer. But generally, most people will experience some form of fatigue during chemotherapy.
If you keep a very positive attitude and do a bit of light exercise when you feel the energy is okay, you actually can cope with the fatigue better. So do rest a bit more, maybe get at least 8 hours of sleep a day, and feel free to nap. This is one chance in your life where you can nap freely and people will understand. And if the fatigue becomes unmanageable, talk to us. We need to find other reasons that we can correct it. For example, if your red blood cells or hemoglobin is too low, causing fatigue, we can do something about that to raise your energy level a little bit.
From day 1 to the last day of my treatment was the fatigue that I went through. You had no energy to do anything. I feel lousy for 2 weeks, but the 3rd week, my final week just before I go to my next treatment, oh, I feel fantastic. The cycle was like that for me. 2 weeks I'd be tired, then the 3rd week I'd be great.
Nausea can range from very mild nausea, whereby you might just have a little bit of change in the taste, or it could be something a bit more severe to where you're almost vomiting a few times a day.
You don't have to worry too much about it. If you take the set of medicine we give you, it is something that we can control fairly well. Some chemotherapy, unfortunately, can lead to some change in your bowel habits, either constipation or diarrhea. They make you uncomfortable, and sometimes you get a bit dehydrated if you have too much diarrhea. But medicine, again, is available to control your diarrhea on one hand or the constipation on the other hand. So with these medications, I expect you to go through the treatment without too much change. Very important side effect, I want you to pay special attention: fever during chemotherapy. Fever sometimes indicates that your white blood count, what we call WBC, is too low. If the white count drops below a safe level, your immunity may be compromised to the level where infection can come in. Should you have any fever more than 38.0 degrees Celsius, measured by the mouth, you should immediately inform your doctors, either by phone call or come back to the emergency room without delay. If the result of the WBC is normal, you may go home usually. If the white counts are too low, your oncologist will be informed and will give you antibiotics to control and manage the fever. But fortunately, nowadays, with the way we give chemotherapy and support the white blood count, this fever episode should be quite rare, but just in case, so that you know how to react should it come up at all. any side effects that you have, don't wait until they are too severe before you report to us. Tell us early. Our whole idea is to manage the side effects when they are early so that we can avert a hospitalization.
Your doctors will be contactable at any time during your chemotherapy because we want to make sure that in case of any emergencies that we are there for you. Some doctors will provide you their mobile numbers, others might provide you with an emergency number to contact, and obviously during office hours the clinic is always available for you to come in at any time. You can call the clinic to make an appointment to see us at any time as well.
When you're on chemotherapy, diet is very important because on one hand, you must take certain good food to make sure that you're strong and you can recover well from the treatment side effects. On the other hand, there are some specific items in the food that you should avoid in order to avoid interactions with your chemotherapy that either bring you more side effects or make the treatment less effective. Make sure that you have enough proteins in your diet. Make sure that it's well balanced with fruits and vegetables. Don't go extreme on one or the other. Have a balanced diet and make sure that hydration is well taken care of. So talk to your oncologists and nurses and they give you better advice. During chemotherapy, it's important that you maintain a very positive attitude. But if you take a very positive attitude towards the treatment, knowing that the treatment is meant to help you, not meant to harm you, you will embrace the treatment better and the overall experience will be a more positive one. And importantly, do continue your usual social interactions.
You might find that it will help you as well if you talk to people about it. Now that you can talk to your doctor, your nurses at any time, but family members as well and friends, it's a good time to talk to them about this treatment journey that you're on. And often you'll be surprised at how much people are willing to support you and to encourage you and keep you going, even during this difficult time in your life.
My number one advice for cancer patients who are going to go through their first chemo is to have a very, very positive mindset. That's why the support group meeting is so important, because everyone at the meeting has gone through it, but they're still so positive. So I think it's this type of positive energy which cancer patients actually need.
Increasingly, with the research coming in at a very, very fast pace, it is hopeful. So stay positive, and if you have fear, talk to your caregivers, talk to your doctors, talk to your friendly nurses. We're all here to help you.